Hello and welcome to an introduction to infection control. By the end of this session, you will have obtained understanding and knowledge of common infections and their vectors being methods by which diseases spread, how an attitude of cooperation and commitment can enhance infection control and improve patient care and outcomes, the skills necessary to provide safe care. Healthcare-associated infections, or HAIs. Healthcare-associated infections are those which the patient didn't have prior to undergoing care and treatment. They result from environmental circumstances, an admission to hospital or a care home, or from contact with healthcare professionals administering care and treatment. An estimated 300,000 patients a year in England acquire a healthcare-associated infection as a result of NHS care. The impact of healthcare-associated infections are that they increase patient suffering, they lead to permanent disability, they lead to death, they prolong hospital stay, they increase the need for a higher level of care, they increase the cost to patients and hospital. Preventing infections, the knowledge required is the knowledge of the extent of the problem, knowledge of the main causes, modes of transmission, and types of infections. Preventing infections, the required attitude, involves working as a part of a team with a shared team approach. Commitment to the prevention of HAIs and preventing infections, the required skills are applying universal precautions, use of personal protection methods, knowing what to do if exposed, encouraging others to use universal precautions, reporting breaks in technique that increase patient risks, and observing patients for signs and symptoms of infection. The chain of infection. First, there is the organism itself. It could be a bacteria, a virus, parasite, or fungi. Then there is the reservoir. This is the continuous source of infection where the organism lives. It could be an environment, a hospital, water supply, an animal like a rat, bird, or a human being. The portal of exit. This is how the organism leaves the reservoir, the vehicle in which it travels. It could be in feces, blood, mucus, or contaminated water. Transmission. This is how the organism is transmitted to a person. It can be from one host to the next, such as a mosquito or flea bite. It can be in blood, semen, hand contact, hand to mouth. The portal of entry. How does the organism get into the body? Could it be through the nose, the mouth, the skin, eyes, ears, or other orifices? Vulnerable hosts. Who is the most vulnerable to this organism? The very young, very old, or those with a pre-existing condition? The main sources of infection are person to person via hands of healthcare providers, patients, and visitors. Personal clothing and equipment, for example stethoscopes, flashlights. Environmental contamination. Airborne transmission. Healthcare professionals who are carriers. Standard approaches to preventing HAIs. Maintain cleanliness of the environment. Personal attention to hand washing before and after every contact with a patient or object. Use personal protective equipment whenever indicated. Use and dispose of sharps and other potentially infected materials safely and appropriately. Hand washing is of primary importance. It is the single most important intervention before and after patient contact. Required knowledge and skills for hand washing include how to clean hands, the rationale for choice of clean hand practice, techniques for hand hygiene, protecting hands from contaminants, promoting adherence to hand hygiene guidelines. My 5 moments for hand hygiene. The My 5 moments for hand hygiene approach defines the key moments when healthcare workers should perform hand hygiene. Before every patient contact. Before aseptic task. After body fluid exposure risk. After every patient contact. After contact with the patient's surroundings. Before touching a patient. When? Clean your hands before touching a patient when approaching him or her. Why? To protect the patient against harmful germs carried on your hands. Before clean aseptic procedure. When? Clean your hands immediately before performing a clean aseptic procedure. Why? To protect the patient against harmful germs, including the patient's own germs entering his or her body. After body fluid exposure risk. When? Clean your hands immediately after an exposure risk to body fluids and after glove removal. Why? To protect yourself and the healthcare environment from harmful patient germs. After touching a patient. When? Clean your hands after touching the patient and his or her immediate surroundings when leaving. Why? To protect yourself and the healthcare environment from harmful patient germs. After touching the patient's surroundings. When? Clean your hands after touching any object or furniture in the patient's immediate surroundings when leaving, even without touching the patient. Why? To protect yourself and the healthcare environment from harmful patient germs. Best practice. Remove all wrist and hand jewellery. Cover cuts and abrasions with waterproof dressing. Keep fingernails short, clean and free from nail polish. Hand washing technique follows this set procedure. Wet hands under tepid running water. Apply soap or antimicrobial preparation. Solution must have contact with the whole surface area of the hands. Vigorous rubbing of hands for 10 to 15 seconds, especially the tips of fingers, thumbs and areas between fingers. Rinse completely. Dry hands with a good quality paper towel. Now watch the following video. Waterless antibacterial gel. Apply a palmful of product in the cupped hand. Rub hands palm to palm. Right palm over left hand with interlaced fingers. Palm to palm with fingers interlaced. Backs of fingers to opposing palms with fingers interlocked. Rub between thumb and forefinger. Rotational rubbing backwards and forwards with clasped fingers of right hand in left palm and vice versa. Once dry, your hands are safe. Personal protective equipment: gloves, aprons, gowns, eye protection and face masks. Healthcare workers should wear a face mask, eye protection and a gown if there is the potential for blood or other bodily fluids to splash. Protective personal equipment number 2. Masks should be worn if an airborne infection is suspected or confirmed to protect an immune-compromised patient. Gloves. Gloves are now an everyday part of clinical practice. There are 2 main indicators for wearing gloves in the clinical setting: to protect the hands from contamination with organic matter and microorganisms, and to reduce the risk of transmitting microorganisms to both patients and staff. When, in the event of all invasive procedures, coming in contact with sterile sites, contact with non-intact skin or mucous membranes, all activities assessed as having a risk of exposure to blood, bodily fluids, secretions and excretions, and handling sharps or contaminated instruments. Safe use and disposal of sharps. Keep handling to a minimum. Do not recap needles, bend or break after use. Discard each needle into a sharps container at the point of use. Do not overload a bin if it is full. Do not leave a sharp bin in the reach of children. Minimizing the spread of infection. Before contact with each and every patient, clean hands before physical contact. Clean hands before an aseptic task. After contact with each and every patient, clean hands after any risk of exposure to body fluids. Clean hands after actual patient contact. Clean hands after contact with patient surroundings. Remember, if we all apply the same best practices in the same effective way, working as a cohesive team, then risks are reduced and care, treatment, patient outcomes and staff well-being are enhanced and improved. Thank you for your time and attention.